Good morning. I wanted to spend a few minutes to talk about pricing and the major variation that is sometimes found when looking at different surgeons, different areas with regard to the cost of getting aesthetic facial plastic surgery done, whether that may be brows, eyelids, fat transfer, and something that I specialize in, which is facelifting. So let's talk a little bit about a few factors that might lead to differences in pricing that patients might encounter as they do research, as they interview surgeons, as they get quotes. The first and foremost is really the surgeon's specialization and focus, sometimes related to also their board certification or their double board certification in some cases. So surgeons that focus on the aging face, that's all they do. They spend hours hours and hours and hours studying, going to meetings, talking to colleagues, trying to develop their skills to be able to offer the best possible facelifting procedure to their patients. I think that comes at a higher price. And so a lot of surgeons that specialize in the face, where facelifting and aging face is basically the vast majority of their practice, I think will probably, you'll notice that their fees for facelifting are higher, partly because they've spent a lot of time and effort trying to develop their skill, trying to develop the facelifting procedure to really improve their results as best as they can, because that's what makes them, so that's what makes them really, really good facial plastic surgeons. It's their outcomes and their results. So that's one element that differentiates surgeons as far as cost. The second thing is geographical area. Patients have to understand that although there is a higher number of very highly trained aesthetic surgeons in more populous areas like New York, Chicago, LA, and the Bay Area, that comes at a higher cost, not just for the real estate and how much it costs to run a practice, but also the cost of keeping and retaining highly qualified staff, right? That complement and provide much needed support to the surgeon. So I think that depending on where you go, if you're looking at the coast or bigger cities, you will most likely see a little bit of a bump in terms of cost as it relates to facial plastic surgery quotes compared to other areas, and even areas abroad where maybe the overhead costs is lower, and so that the surgeon's fees and various other associated surgical facility and anesthesia fees might be a little bit lower. So that's another reason why there's some differentiation. The third factor is really, what are you getting when you're getting a facelift? And some people walk in and say, look, I don't want a facelift, I just want to deal with this. And I tell them that mostly when people talk about facelifting, it really generally relates to the lower face, right? And then depending on what the patient's needs and desires are, concerns are, things can be added on, such as eyelid rejuvenation, brow lifting, chemical peels or lasers, and also fat transfer. So sometimes as you're considering costs, know that you have to also consider what all is being offered, what is being suggested. The more things that you do, the longer the time that it takes to do those procedures, and so that can also bump up the cost of facility, surgical center facility costs, fees, anesthesia fees. So as you're looking through various quotes, you're going to be mostly looking at surgical fees that are associated with the surgeon. There is a surgical center and facility fees, as well as anesthesia fees, and so sometimes that can be different based on how long it actually takes to do these procedures. And I've mentioned this before, but when you're really trying to get the best possible result, speed is not one of the things that we take into consideration. So more comprehensive lifts do take longer, and if the surgeon is doing most of the work, it does take longer. And so just know that that's another thing that you need to be considerate of as you evaluate how long it takes and why that reflects to a higher cost of surgery. Hopefully that helped explain a few of these things.